Hey, my knee locks up. Why does my knee lock up? Hey, this is Dr. P. Got a problem with your knee? Ask Dr. P. And I get asked a lot of questions about, hey, my knee is locking up. What do I do about it? Well, first of all, why is it locking up? We got to figure that out first before we can figure out what we can do about it. So this is a knee model, and this is the femur, the thigh bone. This is the tibia, the shin bone. This is the outer bone, the fibula. This is the patella, the kneecap. And there's two types of cartilage. There's the cartilage on the end of the bone, which looks like the white on the end of a chicken bone. When that wears down, that's like the tread on a tire. That's what arthritis is. But if we zoom in here, the meniscus cartilage is the shock absorber cartilage in between the two bones. And so there's a medial one on the inner side of the knee. There's a lateral one on the outer side of the knee. It's kind of fibrous, like it's kind of fibrous and rubbery like you see here. And I made what we call a bucket handle meniscus tear. There's a bunch of different types of meniscus tears. We can go over them in future videos, but this one's one of the most common. And a bucket handle looks like a bucket handle, and it can flip back this way and it can flip back this way. When it's this way, the knee's not locked up. It might hurt. But when it flips this way and it gets in between the two bones, it can lock the knee up. And so sometimes you have to actually shake the knee free to get that to plop back into position. But usually when there is a bucket handle tear, it usually is going to need surgery. And a lot of times we can repair it. Put stitches in here, put some PRP, platelet-rich plasma, put some bone marrow cells, use laser to try to get this to heal. And we'll talk more about the different zones of meniscus and how that affects healing. But this is what a bucket handle tear looks like. And that's just one of the reasons why a meniscus can cause your knee to lock up.